Substance use disorder is a challenge that not only affects the individual, it affects their families, communities, and employers. Isaiah House provides a comprehensive dual diagnosis substance use disorder treatment program utilizing a fully licensed staff of medical and clinical professionals that includes nurse practitioners, registered nurses, psychiatrists, therapists, peer support specialists, and targeted case managers. Isaiah House can treat the whole person and provide an individualized treatment plan to help clients achieve a lifetime of recovery. Isaiah House is proud to be nationally accredited by CARF, a national standard for substance use disorder treatment, as well as by the state of Kentucky for providing comprehensive services to individuals seeking rehabilitation.
When I first became acquainted with Isaiah House, I was just taken aback by their comprehensive nature, their whole person approach, their spiritual development. Everything about it just hit me because I saw those were the areas that my patients would fail. And Isaiah House had contingency plans for all that.
A lot of times there's a holistic approach that we want to take to people. Substance use disorder is a medical diagnosis, so they have to have a full psychological assessment that gets done. They talk about issues, withdrawal symptoms. They take a history of what medications they may have been on in the past, what their risks are for relapse, risk for withdrawals. All that gets assessed by a psychology kind of team. Once they're in an inpatient rehab setting, they get assessed routinely there. Once they've gone through that process, a lot of those folks don't have anywhere to go to for medical needs afterwards. And so that's where clinics that we've set up around the state now are starting to play a role. So a lot of folks can't find a primary care doctor, or maybe because of their past, those primary care physicians are not interested in managing people that have had those issues. But we've kind of thought we'd create a medical home for a lot of those folks.
So at any given time, we can have 2 to 3 dozen medical professionals in our department. That can range from nurse practitioners, registered nurses, and certified medical assistants, and LPNs. Medication-assisted treatment is evidence-based practice. Within our withdrawal management services, we use other medications to help with the withdrawal symptoms. Because a lot of times I think that's the fear, is that it's going to be so painful and uncomfortable, that the goal of MAT is to help ease that just a little bit. So within that time frame, they also have peer support. They're also getting their classes, and then of course their counseling services too. So they have all that support during that time period. And that's how I think that we differ a little bit at Isaiah House, because we can come at a person from all angles and treat them holistically.
At Isaiah House, you're more than just a bed, you're more than just another person here. You become a part of a family that loves and supports you and wants to provide you with the resources to be successful in maintaining sobriety. So within the first 24 hours, they are assessed by either a clinical therapist, a clinical psychologist, or a clinical social worker. And during that assessment, we find out about past traumas, we evaluate their substance use, any co-occurring diagnosis, and develop a unique treatment plan for each client to assist in addressing those presenting areas of need. We use evidence-based approaches such as cognitive behavioral therapy, dialectical behavioral therapy, EMDR. Things like these are proven to address not only co-occurring disorders, but also substance use disorders. And it allows clients basic skills that they can apply themselves, because it's important that a client can not just learn the skills, but apply them. We have targeted case managers that assist in meeting needs for the clients. And some of those needs include legal concerns such as court dates, if they need assistance in getting a driver's license, housing placement. So the targeted case manager will meet with the client, and very similar to our clinical process, they develop a person-centered treatment plan that addresses that client's specific needs.
The great thing about having Isaiah House is that we can work with them at Ephraim McDowell to improve the care for our community. So when they have clients that need more intensive inpatient care, they can send them to our facility, and then we will transition them back to the residential program. At the same time, we know that if we have clients that need intensive outpatient treatment or residential treatment, they will do everything in their power to make sure that they have a bed available.
People that are struggling with chemical dependency or addiction are still valuable people. And for a wise employer to seek to help that person get better, you'll find sooner or later that in the long scheme of things, people that are given the opportunity to get better and do will produce for you.
Assured Partners has put together a partnership with Isaiah House. In this partnership, Isaiah House helped to put together preferred pricing for employers who want to offer this treatment facility to their employees and their family members. As an insurance broker, I know that a lot of the professional services that are provided by Isaiah House are not covered by insurance, unfortunately. And what is really neat is that Isaiah House is able to pull from other resources to be able to offer this program at virtually no cost to the employee at times, even though those are not covered by insurance. So I think what Isaiah House can bring is that hope. The employers will experience that success, and then they can get excited that they can see a turnaround take place with an employee or their dependent for that matter.
In close to 25 years of clinical experience, the one thing I've really learned is that treating someone for their addiction is not just about getting them sober and turning them loose. It takes a lot of concentrated, skilled effort to bring people to the level of functioning in the real world and keeping them there. If you want somewhere that has the history, the developed skill, the services that are needed to accomplish this purpose, I think Isaiah House is the hands-down choice. I trust them with patients. I would trust them with family if the need ever arose. I've trusted them with my reputation by being on their board of directors. And the one thing I can promise is that we're always there working for our people. And I would just encourage you that if there's anyone you know that needs help, contact Isaiah House to see how we can help.